Hi, my name is Yannick Dentist. I'm a family nurse practitioner, and I'm going to start my YouTube channel. Uh, the topic will be advanced health educations. So um, the video will be focusing on advanced health. For it's going to be for educational purpose only. This video does not intend to give advice or to treat by any means. Please contact your primary care provider for any medical advice. Um, if we start about with diseases, what is disease? According to Wikipedia, disease is an abnormal condition negatively affect the structure or function of all or part of an organism. Also, diseases are often known to be medical conditions that are associated with specific signs and symptoms. Also, according to Wikipedia, a disease may be caused by external factors such as pathogens, like the big pandemic we just had. I mean, we still have it, which is COVID-19. This is external pathogens, and that can be caused also by internal dysfunction, like cancer, like blood clots, etc. And also, before we start, always keep in mind um, God, He's the one who heal all diseases. So we can go to Psalm 103, 2 and 3. Psalm 103, 2 and 3 says that, "Bless the Lord, O my soul, and forget not all his benefits, who forgives all your iniquities, who heals all your diseases." So we cannot forget that when we're sick, we have to ask for his help, um, because he's the greatest physicians. So let's move on with the um, poster that you are looking right now. What is the warning signs for heart attacks? For men and women, most heart attacks start slowly with chest pain or discomfort. Women are more likely to also experience shortness of breath, nausea and vomiting, back and jaw pain. So for men, most of the symptoms they said, it look like they have that elephant who just sit on their chest. This is mostly men symptom. The women's symptom is kind of different. Them they complaining of shortness of breath. They might have nausea and vomiting, and also back and jaw pain. So the warning sign include, again, chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes, or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, kind of fullness or pain. And also we can have symptoms like discomfort in other part of your body, upper part of your body. Symptoms such as pain, discomfort in one or both arms. Most of the time, sometimes it's the left arm because it's closer to your heart, your back, neck, jaw, or stomach. Shortness of breath can be with or without chest discomfort. So you don't have to have chest discomfort with shortness of breath. And other signs also can include breaking out in a cold sweat. So we cannot confuse that with hot flashes. Okay, sometimes, if somebody have a cold sweat, think about sign of heart attack. Also, that person can have unusual fatigue. We cannot confuse that for like you have weakness or you have anemia. Sometimes the person might think, oh, I work too much. I may be anemic. No, that unusual fatigue might be associated with heart attack and nausea, and also might have lightheadedness. It's not like big headache, but you can have it, and also you can have that headache as well also. So if we have all those kind of symptoms, the warning sign of symptoms, chest discomfort in other areas of the upper bodies, shortness of breath, and cold sweat, unusual fatigue, nausea, lightheadedness, please, you must call for you, if it's for you or for your loved one, you must call 911 immediately. This is an emergency medical condition. So someone who have those symptoms, please, you need to call 911. If you have one or more of this warning sign, is very, very important. Okay. So now we're going to switch gear with warning signs for strokes. Warning signs for strokes. So one thing I want you to remember, if you have any blood clots in your heart, we call that. That's why we call it heart attacks. If that blood clots move into your brains, then that's strokes. Okay, so the one is, so we have, I just finished with the warning signs for heart attacks. Now we're going to go with warning signs for stroke. The warning signs for strokes, the key word is sudden. If you have sudden numbness or weakness of your face, of your arm, legs, especially on one side of your body. Okay, if suddenly you see you have weakness, it's sudden. It comes sudden. You didn't have that. You just have it. This is a red flag. Also, sudden confusion, trouble speaking or understanding. That person, that loved one, can look at you but they cannot speak. That's sudden. It wasn't there. Also, sudden trouble seeing in one eye or both eyes. It can be one, it can be both. If you tell your loved one or you close one eye and you see that you have blur vision, you cannot see, you didn't have that, you didn't have that couple of hours ago or yesterday, that comes sudden. This is warning sign for stroke. Other warning sign for stroke is sudden trouble walking, dizziness, another symptom, loss of balance or coordination. So if all of us sudden, you or your loved one used to walk and now you see that person, they cannot walk, they have trouble of walking, they are leaping, they lost balance, they lost they can. So this is a warning sign. And other sudden symptom also is severe headaches with or no known cause. some people never have that pain before, never have had the headaches, never have pressure, and then one day like that, you have that uh, headache, and that person will can tell you, I never have that pain, that pain in my head that never have that. That's new. So this is a warning sign. This is a red flag. So let me repeat again. The red flag for stroke: sudden numbness or weakness of your face, your arm, your leg, especially on one side of your body. It could be left side, it could be right side, depending where is your stroke. If it's in your left side, if your stroke is in your left brain, your weakness will be your right side. If your stroke is in your right side, your weakness will be on your left side. So that this is how it goes. And also, if you have sudden confusion, trouble of speaking, understanding, this is a red flag. Warning sign again: sudden trouble to see. If you cannot see in one eye or both eyes, this is a sign also. Trouble of walking, you are dizzy, you don't have balance, coordination. So this is another symptom. And also severe headache. Headache, you never had that before. That's new. It just came. You said, my God, I never, this is the first time I have headache like that. I never had that headache. So you have to act fast. You have to call 911. Immediately you call 911. Even though the loved one said, oh, if I go lay down, I will be fine. No, even if it's for you, you think you will be fine. You think, no. If you have all those symptoms, all those warning signs for heart attacks, for stroke, you need to act fast. You need to call 911 immediately. And also remember stroke. Remember the stroke warning sign with the acronym FAST. That's why there's an acronym FAST. So F mean face. So the face. So ask the person to smile. Does one side of that person's face droop? If that one is lower, you have some face droop. So this is a sign. The arms, A stand for arms. Ask the person to raise both arms. Does one arm drift downward? So that person don't have that arm don't have no strength. So instead of keep it straight, it just drop. It just go down. So this is a sign also. The S stand for speech. Speech, you ask the person to repeat a simple phrase. Is their speech slurred or strange? Sometimes they're heavy. They're trying to speak, but they cannot. Their tongue, is heavy. And if you used to that person, it's easy. You said, there's something is wrong. They're trying to speak, but they cannot speak. Spit it out. They know what to say, but their tongue, their mouth is too heavy. So this is another warning sign. And also the T stand for time. So time, if you observe any of these signs, okay, such as, I just repeat, all those signs we just discussed, you need to call 911 immediately. That person needs to go to the ER, and then when they reach there, they have to do all those lab work. They have to do the lab work. They have to do the scan. They have to scan their brain. They have to do an X-ray to see really what's going on. And the thing is, we have to remember, if we act fast, there is sequela. Sequela mean, sequela mean the damage. As long as we act fast, your loved one or you will have less damage, because you will get the treatment fast, and that can really, really help you. So please, if you have all those symptoms and review those that poster, that's why I post that. So you always have that, you always review it, you look at it. And if you and your loved one have all those symptoms, there is no but or if. You need to go, you need to call 911. Please do not drive. Some people, they do that. Do not drive because this is dangerous for you or for others. This is really not safe. So, or if you can, or if you if somebody is with you, ask that person to call 911 for you if you cannot call. But the thing you have to remember, it's to call 911. This is a medical emergency. So again, I'm going to resume. So the heart attack and the stroke is two medical emergency who need immediate attention. You need to call 911 to go to the emergency, the closest, the ambulance, the EMS to come. They know that. They are not going to drive. Even though you tell them, oh, I want to go to the hospital closest to me, no, they're going, if you ask them, if you have a special place to go, hospital to go, they are going to bring you to the nearest hospital because you need to get treatment as soon as possible. And before we close, I just want to go over about disease. So this channel will be about advanced health education. So mostly what we're going to talk about diseases, we're going to talk about prevention, we're going to talk about treatment. So according to Wikipedia, again, what is disease? Disease is an abnormal condition negatively affect the structure or function of all or part of an organism. So for heart attack and for stroke, what is that abnormal condition? That abnormal condition is you have a blood clot who affect your heart. That's why you end up with a heart attack, and if it's in your brain, that will cause stroke. This is the abnormal condition. And also, so hopefully that video will help you, will remind you, because more and more people have those two conditions, believe it or not. If you have high blood pressure, if you have a high blood pressure, you are on medications and you don't take your medication, your pressure is always high. This is something you have to think about it that can cause that. Also, there's one condition also, atrial fibrillation. Atrial fib, you need to take your medication. Whatever medication your doctor gives you, you need to take it, because with AFib, if you don't take your medication, it's prone to do clots, and that will throw the clots. If that clots go into your heart, that's when you're going to have a heart attack, and that clot travel through your brain, and you're going to have a stroke. So atrial fibrillation, high blood pressure is very important. If you have them, please contact your doctor, your primary care physician, your nurse practitioner, your physician assistant. You need to be close. You need to follow close to them, with them, sorry. And that will help you to have an optimal health, because that's what we need. We need to, whatever we have, we need to control it. We need to really follow the guidelines, and that's why we have guidelines, is to help you so you can enjoy your life. On that, I'm going to leave you by saying thank you for watching the video, and also please do not forget to like and subscribe the video. Thank you, and next time, and I wish you the best of health. Bye bye.